Okay. Can you hear me?
Yeah, yeah,
Okay, good. So we're live now. Okay.
yeah. So I'll just share it on my Facebook and then we'll get started. Yeah, I'm so excited for this interview today after my whole Mudra course and with the new Mudra book coming up. So this is going to be really exciting. Sweet. Okay. Interview with. Okay. All right, here we go. Welcome, everyone. And today we have Dr. Anand Chaturvedi with us. And he's live with us from Akron, Ohio. Mm. He's a
Hello.
so he's a professional psychiatrist, and we have been friends for a long, long time. And recently, after I wrote my book on mudras, Dr. Chaturvedi was one of the first to buy the books and also take the whole course on the mudras. So we are very fortunate today to have a live discussion. We've been trying to hold for quite some time, and I'll be handing him over the certificate for completing the course as well. So, firstly, as a psychiatrist, like in a professional field, so I would like to ask Mr. Chaturvedi, how do you see mudras affecting the mind or helping or benefiting? So, could you share your experience?
Well, Yogi Natras, thanks for having me here. It's a privilege, and it's actually been a great privilege to learn the mudras from you. You teach so well. So mudras in my practice, I think they hold a very significant place, and over the past year, I've been trying to incorporate them into my practice. I think where mudras can help in the mental health field is, I think, especially with depression, with anxiety, with people who have eating disorders, insomnia. Um, I think those are the places where we can really improve patients' lives. I see a lot of benefit, and actually, I see patients right now who are practicing mudras to help alleviate their anxiety, whether it's panic disorder, whether it's generalized anxiety disorder, and even OCD. I have had patients. In particular, one patient who's done very well with the meditation and the mudra, and we reduced her dosage of medication, and she's doing very well. So I tell patients to incorporate mudras into their lifestyle. So whether it's when you're doing meditation, when you're walking, oftentimes what I do is I introduce mudras when I'm talking about lifestyle changes. We prescribe medicines to help with their anxiety. We prescribe psychotherapy, but then I also tell patients, just like with other disorders, that you have to make some lifestyle changes in order to get this condition under control. So that's how I introduce mudras, and that can lead to a further discussion. And I teach them mudras to help with their mental health issues.
Which mudra do you find like very beneficial for anxiety?
What I've found, the Gyan mudra, this one, yes. First of all, for people, most people in the Western world are not very conversant with the topic of mudras. So the Gyan mudra is very easy to do. They can sit down and they can meditate. They can sit, if they're on their sofa or on the chair or in their office, wherever. A very easy mudra to do. You can do it as much as you want. And I also recommend the Gyan mudra for people not only with anxiety but also with insomnia. A lot of my anxious folks have problems falling asleep. They have the racing thoughts. They can't shut their mind off. So I've been using the Gyan mudra a lot to introduce people to mudras. So
Wow, wonderful. Yeah. So Gyan Mudra, of course, we know helps a lot with you know many memory, reducing anxiety, reducing stress levels.
Yeah. Hmm.
Is there something that you found useful that improved sleep?
Yeah, I mean, again, I think the Gyan Mudra is good, and I also like the Pran Mudra. I've heard the Pran Mudra. Yes, this also helps with sleep, and oftentimes I use it myself when I'm going to bed. So um, both the Gyan Mudra and the Pran Mudra, I think, are really helpful mudras. So, and also I've seen people who have been depressed and they have low energy. I think the Pran Mudra helps increase their energy level. So and increase their vitality, increase their mood. So I'm looking to use it more for my depressed patients also.
Oh, wonderful. So you mentioned that by practicing mudras, some of your patients could reduce their medications, also.
Yes, yes,
So
yeah.
how long, what is the time span they have been practicing mudras for?
Well, I mean, usually I see when I see patients, I see them once every few weeks, especially if they're newer patients. So, generally over the course of 2, 3 sessions, 4 sessions, so we're talking about maybe a month, 2 month, 3 months over that stretch of time, they come back to me and say, "Yeah, you know what? I'm beginning to see some effects now, and I'm using less of my anxiety medicine. I don't need it as often, and I'm doing better. I have more energy. I'm exercising more." You just see general improvements in their life, whatever issue they're struggling with. A lot of times people with depression and anxiety also have low energy. They have low motivation, and so you see those things improve. Or you have the family members come in and tell them, you know what, their mood is better, they're more engaging now, they focus better, they pay more attention, all these things. So
Hmm. Yeah, and today, especially with this, hostile environment on TV and
social media.
media in general, and stress levels everywhere. So, in general, as a psychiatrist and as also being a traditional practice, we've been practicing almost like 6 to 8 months now
Yes.
together. Now, in general, people who are listening, so as a doctor, from your perspective, how long would you recommend that somebody practices a mudras per day?
You mean per? I mean, it depends on the mudra, I guess. But what I tell patients, if you're starting out and you're new, and say, for example, if somebody has anxiety, I tell them Gyan Mudra, 5 minutes in the morning, 5 minutes in the evening. Put a timer on your phone, and then gradually build up the practice. Do 5 minutes, do 10 minutes, do 15 minutes. At a minimum, I would probably recommend doing 15 to 20 minutes twice a day. To get the best effect. But I tell patients, do it as a routine. When you get up in the morning, do it. Put a little timer on your phone so you don't have to guess how much time it is, and then get in the habit of that. Do it some before you go to bed. So
Mhm. Yeah, that's really true. That if you are able to do it consistently,
mhm.
keeping a timer,
Yeah.
and say we put together a cluster like series of mudras, like Gyan Mudra,
Mhm.
and the and like a Mudra series. Have you given like, apart from single mudras, have you taught somebody like a series or something?
Not
Or we,
yet. I'm working on that. I do have some patients who I'm thinking of doing that. But mostly I've been teaching them simple mudras right now. They can sort of, yeah, I sort of want to see, okay, if you're doing one mudra consistently, then we will add more to it. So, I think
Mhm.
consistency is the key. Even if you do it for just 5 minutes twice a day, 10 minutes twice a day, do it rather than, you do it one day, 40 minutes, and you don't do it the next day. That's not good. But yeah, as the year goes on, I'm looking forward to using more of those concepts from the book and teaching patients as it's appropriate. So
Mm, wonderful. So you are a practitioner yourself, plus a doctor, and according to you, how does it work from a psychiatric perspective?
I mean, anything, and we borrow a lot of this from Eastern teachings too. When I have my therapist or my counselors do what we call CBT, cognitive behavioral therapy, one of the central precepts of cognitive behavioral therapy is the concept of mindfulness, where you focus and you pay attention to what you're doing, anything that you're doing in your day, or you are mindful of your own feelings and your emotions, and you sit with that, and you become like a detached observer of your feelings. So when you do a practice like yoga, or you incorporate mudras, you're actually sitting down and you're calming your brain down. And I tell patients, listen, when you do the mudra, you sit down and you take nice, deep, slow breaths, and you sort of calm the mind down. Okay. And these are some of the same techniques that in other ways that we teach in our CBT classes too, where you learn to take deep breaths, you do body scanning, you learn to recognize your emotions. So I think the practice of mudra and meditation in general adds to those other teachings.
Mm. Okay, wonderful. Like the chakra sequence that we did,
Yeah.
we went through the whole chakras, and could you share some of your experience on that? I think you practiced it every day for some time.
I've been doing it for some time, and I try to do it. I always do it in the morning. I try to do it twice a day, once in the morning, once in the evening. And what
Hmm.
I do, I go through every chakra for a few minutes. Usually, I say them out loud at least either 5 or 7 times. I always pick an odd number on each chakra, and I start from the root chakra, the Muladhara chakra, and I'll work all the way up, and I go all the way down the same way. And then I also follow, when I'm doing the chakra meditation, I also do the corresponding mudras with the chakras as I'm going up and down them. So
Hmm.
my personal experience with doing the chakra meditation is that it's helped me become more motivated, become more focused in terms of my professional and personal goals in life. You know, and I think it's important because when you go online or you look at YouTube, there's a lot of information on chakras and how to do this, how to do that. But you have to have a teacher or a guide. I think that's very important, number one, because there's a lot of contradictory information on chakras, as with anything online when you go, you know. But having a guide or a teacher is important, and following that one path is important. So, my personal experience when I do them is I feel an immense amount of peace and just sort of steadies my mind. And you try to balance all the chakras. I don't subscribe to just, well, you focus on one chakra and you balance that, because they all work together. And so you have to work with them all at the same time, I think. But it's helped me tremendously in terms of helping my mind focus and sort of figure out what I want to do. So, and actually, I have one patient in my practice. She's been doing chakra meditation for the past 1 year, and we happened to talk about it one day, and it's helped her tremendously, actually, in terms of she was stuck in a dead end job, and she decided to quit, go back to college, work on her PhD. So just that 1 year, it's brought some transformational changes to her life. So
Hmm. Yeah. So all in all, we know that mudra means brings about mudha. Mudha means to keep the mind happy.
mm-hmm.
And as we practice the mudras on a regular basis, there is plenty of physical, mental, and intellectual changes you go through.
Oh,
Uh, now, uh, do you think it also helps in improving digestion, hunger? Have you
oh,
seen improvements on that?
absolutely. Absolutely, absolutely. I mean, there's one mudra in particular. Actually, there's a couple that can help with digestion and everything, but the one that my personal favorite is the what we call the Agni mudra, the Surya mudra. And
Hmm.
I think at the very least, if you're struggling with weight gain issues, at the very least, it will help stabilize your weight. And then if you incorporate other lifestyle, dietary changes, then actually you can gradually start losing weight. In fact, I have my family members doing some of these mudras with their chronic health issues. So they've caught on. My parents, my sister, some of my work colleagues have started doing the mudras too. So I think Agni Mudra is a good one for digestion. I think also the Kapha Mudra, especially if you are sort of a heavier constitution, or you have a lot of Kapha in your body. I think those are both excellent mudras too. I think also Pran Mudra is good because it gives you energy and it gives you motivation to reach your goals, whether it's exercising, whether it's doing yoga, or having the discipline to do some of those things.
All right, wonderful. I think we that was quite a beautiful things that you shared today, and
Oh
I'm
yeah.
just trying to open up your certificate here.
Okay, good. And you know what? I look forward to the second book too. As soon as you put it out there, let me know. I'm gonna buy it. So
Yeah, yeah, yeah. So that's releasing next month. So here
oh,
is something I would like to share with everyone. So here's share screen. Yeah, sharing screen. Okay. Um, share screen. Okay, so maybe I have to set up all this in preferences. But anyways, so I would like to. Uh, all right, sorry about that.
that's okay. I thought you would come back. So
Yeah, yeah. So yeah, so I was trying to reset, and it shut down my browser. So
that's
anyway,
technology.
so I'll share the certificate later. But anyway, congratulations, Dr. Chaturvedi, on becoming a Mudra certified teacher now.
I
And
appreciate that. Thank you.
so
I mean,
Mudra.
you're a wonderful teacher. I would recommend this Mudra course to anybody who is interested in learning the science. I think this is a science that everybody should be well acquainted with, especially in our day and times.
Yeah, and the next book that I'm bringing out, so it would be a comprehensive, like revised and enlarged. Even I did not think of it, but as my research is maturing on the series, so I would like to show my favorite mudra before we end up, and that's which is getting the most hits on YouTube also. It's got 2,000 views now. So the Surabhi Mudra. So
Oh,
yeah,
Surabhi is one of the most difficult mudras too.
right. So the most difficult,
Yes, yeah. So the
right?
Surabhi Mudra right there, I think. Can you tell us particularly what that's good for? What ailments or what conditions?
So Surabhi Mudra, so Surabhi, like we know as the cow, it represents the teats of the cow,
Hmm.
right? So it represents the teats of the cow. So this, so they four of them like
Mhm.
this.
Like that. Okay.
Yeah, milk, as we know, nourishes the entire body. Mm. So milk, cows, they nourish the entire body. So it balances all the kapha, pitta, and vata. So Surabhi Mudra actually is for, especially for post-COVID complications,
Hmm.
that is one of the best.
Okay.
That is one of the best. So
Well, that's interesting you bring that up because just the past couple of months I've been seeing a lot of my patients who have long COVID symptoms. They've been through COVID, and they've been in the hospital and now they're going through. I think this would be an excellent mudra to teach them. So,
yeah, yeah. Actually, I never realized this at first, but I taught it in general because it balances kapha, pitta, vata. One lady in India
hmm,
whom I met in some is like online program. She told me that she took up this mudra from my from my YouTube, and she
Yeah.
started sharing it. And yes, so
Yeah.
once we started sharing this Surabhi Mudra, people with long COVID, their effects started reducing.
Hmm.
But they would do at least 20 to 25 minutes.
Yeah.
So when they would do 25, 30 minutes, so it would give them wonderful effects. Now in this, there is also, when you do this, and the best thing was, in this there is a variety.
Mm.
Like the ring finger represents the earth, so when you hold the below the earth, below the ring finger, that like this, it prevents any chronic coughing.
You mean when you hold the ring finger up?
See, now for example, the
Mm.
thumb is here, right, on
Yeah.
top.
Yeah.
So when you, instead of holding it like this, I put it at the base of the ring finger.
Okay. Got it.
Yeah. So when I put it at the base of the ring finger, it activates the earth element. It makes your body lighter, lungs lighter. So it
Hmm.
makes breathing easier.
Okay. Can you clarify that when you put the thumb at the base of the ring finger? Is that what you're saying?
Mm-hmm.
Okay.
Yeah, when you put the thumb at the base of the ring finger.
Okay.
Yeah.
You
So
mean the
that,
same side of the thumb or the opposite thumb?
same side.
Same side. Okay. Right there. Like just like that.
Yes,
Okay.
yes.
So this helps with the lungs then.
It helps with the lungs. It helps
Wonderful.
with because the thing is, people with long COVID, they are generally feeling very heavy.
Hmm.
Now, heavy means your body is weak, your passageways are also weak,
Hmm.
your breathing is very weak. It takes a lot to breathe. It takes a lot from you to breathe. So what this does is lightens the whole body.
Hmm.
Yeah. So
Right.
all
Very
from that. Yeah, and more of these coming up in the next book. Yeah,
wonderful.
we'll
Wonderful.
have a lot of fun.
I,
Yeah.
I've been using your which one is this? The Kuber Mudra.
Ah,
Very
business.
very good for small business people.
This should be promoted by the SBA.
Yeah.
To,
Very much so. Yes. Yes.
to promote prosperity in small businesses. Yeah,
Exactly. Exactly. Yes. Yes. They're very nice. Very nice.
yeah, yeah. All right. So wonderful. So thank you for
Thank you.
joining.
And
For
anytime you want me back on, let me know. I would love to share my experiences, and hopefully we'll get more and more people better in the new year. So
yeah, thank you. I'll
okay,
just end live, but I'll just speak to you. Just
okay,
hold on. Yeah.
sure.